Balancing two industry partners, Valeria is taking inspiration from both to challenge the way we detect waterborne pathogens.
A single teaspoon of seawater contains around 10 million viruses. Most of these marine viruses don't harm humans. However, a small subset of enteric viruses, such as norovirus and adenovirus, pose a serious problem when they contaminate water used for drinking, recreation, or food production, and when they accumulate in filter-feeding organisms like oysters. Here's the challenge. These viruses are notoriously hard to grow in culture, and while we can detect viral genetic material in water, detection alone doesn't mean the virus is infectious. Without knowing infectivity, we cannot accurately assess the real risk to human health. And without reliable laboratory models, we also cannot test potential antivirals. What makes my PhD unique is the opportunity to work with two very different industry partners, one focused on marine products and one on public health. This has allowed me to view these challenges from both perspectives, the urgent clinical need for treatments and the industry's need for robust infectivity tests as a means of managing risk. These complementary insights have shaped how I've approached my research. My research is designed to bridge these gaps. I have characterized infection models in novel human cell lines and explored marine bioproducts, specifically a seaweed-derived compound, as a potential antiviral candidate, thereby bringing ocean resources directly into medical intervention. I will now extend this work by developing a novel gut-on-a-chip model to enable rigorous infectivity testing and translate the platform to industry use. This includes risk assessment for reclaimed water, bioproduct surveillance, quality assurance, and public health. The impact of this work is wide-reaching. For agriculture and aquaculture, developing a gut-on-a-chip system provides a novel way to determine whether viruses are not only detectable, but truly infectious, ensuring safer food production and more resilient industry practices. For the marine bioproducts industry, it establishes a framework to test and validate compounds such as seaweed-derived antivirals in realistic infection models. And for public health, it supports safer food systems, strengthens outbreak prevention, and lays the groundwork for therapies against viruses that currently lack treatment options. By combining marine bioproducts with innovative viral models, my research links industry and medicine by modernizing enteric virus infectivity detection in water sources, providing a robust platform for antiviral discovery, and ultimately creating a pathway to the first real treatments for enteric viruses. Finally, I would like to thank my industry partners, SA Water and Marinova, and the Marine Bioproducts CRC for their support in making this work possible.